Caput Succedaneum. What is Caput Succedaneum? It is a soft tissue swelling. It is a edematous swelling of the soft tissues of the scalp. It is a diffuse swelling. It is a poorly defined swelling, and it crosses the midline. It crosses the suture lines, right? So it crosses midline, crosses suture lines. It is often seen after normal vaginal delivery in a vertex presentation. Because most of these patients do not have any bleeding component, so there will be no risk of hyperbilirubinemia other than the physiological jaundice in the child. However, there can be two variations of Caput Succedaneum. One variant is sometimes there can be ecchymotic Caput Succedaneum, that is, small ecchymosis may be present along with the soft tissue swelling. If the echymoses are large enough, then some degree of extra bilirubin may be produced from them, and so some degree of neonatal jaundice can happen. So if somebody asks you, can neonatal jaundice be aggravated by Caput Succedaneum? The answer will be no, certainly not, unless there are extensive ecchymosis in the patient. That will be a variation of Caput Succedaneum. Very rarely there can be a hemorrhagic Caput Succedaneum where there may be bleeding also in the soft tissue area. And if the hemorrhagic variety is significant enough, it can cause shock in the child and may also need blood transfusion in the form of PRBC. But hemorrhagic and ecchymotic variants are relatively less common. What we find is only a soft tissue swelling, which tends to improve dramatically. Now, because the swelling is maximum at this time of birth, it tends to improve as the time passes. So the key point to remember is it is a soft tissue swelling, it is a diffuse, poorly localized swelling, and it will improve as the time progresses. So maximum size will be soon after birth, and then it will reduce in size. Resolves within 1 week, usually 40 to 72 hours, Caput Succedaneum will totally go away. So all the points I mentioned, you must revise them, you must keep them in your mind for cases, for practice, and for Viper.